Let's get the latest now on the pandemic. Over half of U.S. states have now confirmed cases of the new Omicron variant, sparking concerns about a winter surge. President Biden's chief medical advisor, Dr. Anthony Fauci, joins us now. Dr. Fauci, thanks for joining us again. You were last on just after Thanksgiving. Omicron was just in one state then, at least 25 right now. What have we learned about the variant in the last 2 weeks?
Well, we've learned a lot, and we're continuing to learn it on a daily basis, George. First of all, it clearly has a transmission advantage in the sense of in countries like South Africa and now the UK, where you have it competing with the Delta variant in the sense of ability to transmit. It looks like it has a high degree of transmissibility. And that's the reason why you're seeing literally every day more and more countries, and in the United States, more and more states. The thing that's important is that it appears to be able to evade some of the immune protection of things like monoclonal antibodies, convalescent plasma, and the antibodies that are induced by vaccines. That's the sobering news. The somewhat encouraging news is that preliminary data show that when you get a booster, for example, a third shot of an mRNA, it raises the level of protection high enough that it then does do well against the Omicron, which is, again, another reason to encourage people who are not vaccinated to get vaccinated, but particularly those who are vaccinated to get boosted, because that diminution in protection seems to go way back up again. So that's the importance of getting that best and optimal protection you can. The other thing that's important is that we're getting... Go ahead. I'm saying the other thing that's we're getting anecdotal information from, not necessarily confirmed yet, that the level of severity appears to be maybe a bit less than in the Delta, but there are a lot of confounding issues there, George. It may be due to the underlying protection in the community due to prior infections, but these are just preliminary data that we're going to have to just follow carefully to get them confirmed.
You talked about the advantages of the booster. Should we be thinking about 3 shots now as the standard of care?
Well, I certainly think, George, it's the optimal care. I mean, for official requirements, it's still 2 shots of the mRNA and 1 shot of the J&J for the official determination of what's required or not. But I think if you look at the data, the more and more it becomes clear that if you want to be optimally protected, you really should get a booster. And I think we'll be continuing to evaluate what the official designation is. But for now, if you want to be optimally protected, absolutely get a booster if you've already had your primary vaccination.
And projecting forward, should we be expecting yearly boosters?
You know, George, it's tough to tell because the third shot of an mRNA could not only do what we absolutely know it does, is dramatically increase the level of protection, but from an immunological standpoint, it could very well increase the durability of protection by things that you can't readily measure by the level of antibodies, that you might have a maturation of the immune system that would prolong the durability. You don't know that, George, until you just follow it over a period of months. If it becomes necessary to get yet another boost, then we'll just have to deal with it when that occurs. But I'm hoping from an immunological standpoint that that third shot of an mRNA and the second shot of a J&J will give a much greater durability of protection than just the 6 months or so that we're seeing right now.
So boosters seem to help, but the World Health Organization is warning that pushing boosters will worsen the global inequity of vaccine distribution. How do you respond to that concern?
You know, George, that's an understandable concern, but there isn't really that valid if you do both. And we can do both. We are right now vaccinating our own country. We're going to be boosting as many people as we possibly can. But you can also simultaneously make doses available to the developing world. And the United States, quite frankly, has done more than all of the other countries combined. We've given over 300 million doses to over 100 countries, and we will either have given or pledging 1.1 billion doses and an expansion of even more. So we're very well aware of the issue of equity, and we're very firmly in the corner of equity. So you can do both, George. You can take care of your own country and provide doses to the low and middle income countries.
Fewer than 1 in 5 eligible children have received the vaccine so far. What's your message to reluctant parents?
Well, my message to parents is If your child is 5 years of age and older, please get them vaccinated. We need to protect the children. This idea that children are not vulnerable at all is not so, George. I mean, certainly statistically, children do not get as severe disease as the adults, particularly the elderly. But if you look at the number of cases of children, now well over 2 million children from 5 to 11 have been infected. There have been over 8,000 to 9,000 hospitalizations and well over 100 deaths. So it's not only good for the health of the child, but also to prevent the spread in the community. So we have a very safe and highly effective vaccine for everyone, including children 5 to 11. And that's the reason why we encourage parents to get their children vaccinated.
Finally, there's so much COVID fatigue out there. You know that. You must be exhausted yourself. What signs of hope can you point to in this holiday season?
Well, George, we have the tools to protect ourselves. And that's the thing we keep saying over and over again. We have 60 million people in this country who are not yet vaccinated, who are eligible to be vaccinated. And those who luckily did get vaccinated, now we have about 100 million of them that are eligible for boosters. So on that framework alone, just vaccination, we can go a long way to getting us through this cold winter season, which clearly is always associated with a spike in respiratory illnesses. But the other things we can do is to be prudent, namely follow the CDC guidelines that when you are in an indoor congregate setting and you do not know the vaccination status of the people around you, wear a mask. You know, masking is not going to be forever, but it can get us out of the very difficult situation we're in now. So just attention to public health measures that are pretty clear can get us through this. And as we get through the winter and into the spring, hopefully we'll have a much better control over things.
Dr. Fauci, thanks as always for your time and your information.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.